Welcome to the program, and today we come to you from Old Fangak, a remote area in the north of South Sudan where there are no telecommunications, no vehicles, not even motorcycles, and you land here, you forget about your mobile phone. The only mode of transport is by boat. I'm here to interact with humanitarian workers, both local and international, to get a feel of what they go through in order to save lives. And theirs is indeed a daring move. Old Fangak is a remote county in Jonglei State in the north of South Sudan. Very remote. It is located in an area with no telecommunications, no roads, no cars. It is accessible only by boat or plane. This river is known as River Po. It is crucial to the survival of the people of Old Fangak as a source of fish as well as a source of water for livestock and domestic use. People travel in and out of Old Fangak on foot or by canoes on the river. Before civil war erupted in Upper Nile in December 2013, Old Fangak town was home to less than 5,000 people, but the town's population increased tenfold as it became a safe haven for people fleeing the war. The humanitarian situation in the county has been dire, with no medical facilities in place except this hospital, Old Fangak Hospital. It is here at the hospital where I came face to face with what local and international humanitarian workers go through to save lives, many of them daring to work away from the comfort of their home countries. The hospital has received a huge support from Médecins Sans Frontières, commonly known as MSF or Doctors Without Borders. When I visited this area in February 2020, just before the COVID-19 pandemic, Maman Mustafa from Nigeria, who has since left South Sudan, was the MSF project coordinator.
MSF has been working in the All of Fangak since November 2014. The main reason why MSF is here in All of Fangak is to deliver the healthcare services of the need population. After the war, there was displacement of population in this region towards All of Fangak, and SSMR, South Sudan Medical Relief Organization, is the only health actor working in the hospital. There is too many victims. That is why MSF came in to support.
MSF also conducts outreach missions to reach vulnerable people who cannot access the hospital here in Old Fangak.
We have 2 mobile clinics going along the River Fau and also the White Nile. And at the same time, MSF is working in the community. We deployed a model called ICCM, Integrated Community Case Management, whereby we train the communities how to test for malaria, how to check for diarrhea, so that they can treat the children under 5 even when we are not on ground. And the main reason is because to fill the gap of inaccessibility, most of the population at Katap, they are not accessible because of the river challenges, because of the location, because of the swampy area. So that is why for MSF to decentralize these health services down to the villages there. And at the same time, we're having a referral capacity. When we have surgical cases, we refer to OCA in Bentu. We also refer our cases to Malakal.
Doctors here communicate using walkie-talkies as there are no telephone services in this region.
Can you look at me now?
Yeah, you just come out here.
Alexander Pietro from Colombia was the medical team leader when I visited the hospital.
During the rainy season, we have a seasonal peak of malaria that we receive a lot of cases with malaria complicated. We have as well pneumonia, meningitis. We had patients with tetanus.
Why is tetanus common? What causes that?
Tetanus, I could say that the people are living in a really hostile environment, that they can get injury very easily, especially during the rainy season, that the walking is very difficult. They have accidents, they are falling down, they are getting injuries, and then to take care of these injuries is not easy when they are living in remote areas. So sometimes the injuries are infected, super infected. They are not properly clean, and when they can, after 1 or 2 weeks to be having the injury, the infection could develop in tetanus. Dry season, we have another type of pathologies. As we start to receive more patients with respiratory diseases, with asthma, pneumonia, bronchitis, with diarrhea.
Old Fangak Hospital handled 36,000 consultations in 2019. There were 502 deliveries and 800 admissions. By March 2020, there were 150 MSF workers at the hospital.
People living in areas like in the south axis of Old Fangak, like a hut, sometimes take 3 days to reach the facility. By walking. They are carrying with the patient, sometimes 4 or 5 people carrying the patient during several days to reach the hospital. We have a hospital with 35 beds of hospitalization. We have hospitalization for patients, pediatrics and severe acute malnutrition, patient for female, male, and for emergency. In emergency, we have 10 beds where we achieve to stabilize some cases or to hospitalize cases in bad condition. ER. We have also maternity. We are doing inpatient for maternity with 10 beds for hospitalization and 2 beds for deliveries.
Training is a key component of MSF services here. This is aimed at capacity building to impart knowledge and skills to the locals. Erefina Ratemo from Kenya is MSF Academy Country Representative.
MSF has gone through so many scenarios and so many situations and realized that our staffs who are working with us lack skills. And when I say they lack skills, it means most of them have never gone to a school of nursing. And we cannot take all of them to a school of nursing. So then the MSF Academy has come in order to capacity build and train our nurses and midwives in the projects where MSF is.
Sarah Daho from Belgium is in charge of developing curriculum for the nursing and midwifery training.
The biggest workforce in a hospital are the nurses and the midwife. They are the first one delivering care to the patient. And so if they don't have an appropriate training to do their job, then the quality of care could be problematic. And actually in the competency gap assessment, what we could see as the main gaps are either linked to hygiene, to infection control and prevention, or to patient safety. So meaning that if they reproduce the technique the same way as we have been observing today, so the quality of care is poor and so the patient is at risk. So if we do, through the training, increase the quality of care, then the community will be better served in terms of the medical need.
I'm working in OPD as EPI vaccinator. For what I have get in these trainings, so it is good to me. I'm very happy to join these trainings because I don't have knowledge for nurse. So for the future, I want to be a nurse if possible.
Rebecca is a traditional birth attendant who has been training on midwifery. She is one of the dependable locals when it comes to not only handling deliveries at the hospital, but also educating women in the community on the importance of delivering in a hospital.
She said that even since Marion came here, they received many trainings. Even now, they know what they don't know before. They now even know how to check vital signs, to test malaria, to test the syphilis, to test many tests, and now they know how to test them.
Translation services are important too. Ambrose Kakbey says he enjoys helping health workers and patients understand each other through his services.
It's my teacher who trained me since I was at the schools. And then since I finished my secondary school certificate, and then I came and also I trained myself, because like if you want to do something, and then you must learn.
And
like
have interest in it.
Yeah, and then you are interested in it.
Old Fangak Hospital has a long history. Dr. Jill Siemann is one of the pioneer humanitarian workers whose contribution to improving healthcare in Old Fangak is highly appreciated by the local leadership. She shared her story laden with sacrifices and determination to save lives.
I moved to South Sudan in 1989, and I've spent most of my adult life here.
So where did you come from? What's your country of origin?
I came from Alaska in America. When I finished tropical medical school, there was a job opening with Doctors Without Borders in South Sudan. It was in the middle of a Kala-Azar epidemic. So that's why I came, although I expected to spend 2 to 3 years at most. But when I arrived, I came to a place where half the population had already died of this killing disease. And there had been no treatment, if you can imagine that. If you think of any city, any town in the world that you've ever been to, if half the population died of that area, the whole world would know, but nobody knew. And people were just coming in, stick people, day after day after day, people walking, carrying sticks, supporting each other, looking just like sticks themselves, hoping that perhaps they could find treatment. And once that happens, and once you become part of that culture, it's really lets you stay.
And tell us about the origin of this place, this hospital.
So after that, I stayed in South Sudan. We ended up treating Kala-Azar, which is the name of the disease that killed people. It's transmitted by a sandfly, and sandflies are all over in this area. But after they started living, people started dying of TB. So we decided to treat TB and became our own NGO. Eventually, we were asked by the people of Fangak to please come here, that they knew of us for treating Kala-Azar, but they also had TB, and would we please come? So that's how we ended up coming to the Fangak area.
Peter Sanduk, a local clinical officer who was born in Old Fangak but educated in Juba, has made a contribution too. He says he returned to Fangak to give back to the society and joined Dr. Jill in the quest for improved health services.
We are working with SSMR, which is South Sudan Medical Relief, with Dr. Jill. Before 94, 93, some time back, I was in charge nurse, because that period there was no health status here in the level of the county as whole. But I came from Khartoum by then. I tried to establish with the support of UNICEF, 94, 95, until Dr. Jill and MSF Holland came and shared the activities with me here. In the long run, MSF came in 2014, so we were working as coalition of partnership together.
Old Fangak remains a safe haven for many displaced persons. Many lives have been saved at the hospital. Not to forget the role the religious community is playing to alleviate poverty. Here, the presence of Komboni missionaries of the Catholic Church is felt as the church continues to minister hope and unite the community. A big sacrifice indeed, and that's what daring humanitarian workers go through in order to save lives in remote areas. We now take a short break. When we return, our 4-hour experience on River Po as we went out for an outreach mission. Welcome back. Today's episode of Daring Abroad is a special tribute to humanitarian workers in Old Fangak, a region in the north of South Sudan where there are no vehicles, there are no motorcycles, there are no telecommunications. The only mode of transport is by boat. And this is how boats come in handy for outreach missions. Take a look. It's 7 a.m. it's gonna be a long day. Our outreach journey begins here. As we pack our belongings, the MSF health workers are keen to ensure that they've carried the right equipment and medicines. Motorboats or engine boats are key to the outreach missions. We are headed to a remote village known as Pakur. We will take about 4 hours on the boat ride. And I'm told here we are going at a speed of about 45 kilometers per hour. On the way, we bypass quite a number of canoes on the river. You'll be surprised, some just float on dry grass downstream. Remember, in this region, there are no vehicles, no motorcycles. The only mode of transport is by boat. It turns out to be like an adventure on Po River as I enjoy the sceneries around, the cool breeze and the company of various nationalities on the boat. Daring abroad. We finally arrive at Pakur. Patients who've been waiting for us eagerly start trickling in. The local leadership, Makiu, had already been informed about our visit. One big achievement is the training and involvement of the locals in health service provision in what is known as integrated community case management.
We are doing malaria and we are doing the diarrhea and vomitings. The MSF, they come and they train us with how we can prevent the diseases to the community, and they train us to give the small children the medicine, and between community and MSF. So the community, they select the CBD, community-based drug distribution. So they select the 9 CBDs for me. So I'm their supervisor. So I will be trained by MSF, so how to give the medicine to these people, and I go and train the CBD, how they can prevent the children and how they manage.
How do you spread the word? How do you reach out to people, to communicate to people now that there is no mobile phone?
I used to move because this my leg is they are better than they are better than someone.
You walk.
So I'm walking. I'm going somewhere there for mat and minimum.
So, but others, how do you send people messengers when there is something?
So we didn't make any communication with anything rather than someone who can go to send. And if there is any issue, you can send someone. Can send someone to talk with these people. You say this and you say this and you say this.
Among the patients here, there are those who are conversant with basic drug handling and distribution. They are known as CBDs.
So she say her works. So you do the 2 ICCM activities. So you do the malaria and diarrhea. For a child who is from 2 to 11, 1 to 5 years old. You're doing the malaria and diarrhea. It is to serve the community within the South Sudan, but now especially in Fangak County and Ayot County.
What are you able to test on immediately, instantly? What kind of diseases?
We just test with urine dip sticks. In the urine dip stick, we just test 3 types of diseases. One is hepatitis E, that found in the urine, and second is bilharzia, that you found it when you see the blood in the test. You might know that this is a bilharzia. Yeah.
And for malaria?
For malaria, we just do RDT. Today we test 2 from here, and 1 is positive and 1 is negative in Pakur.
So how many people have you seen today?
Today we see
for the poor patient.
Time well spent in Pakul. We took about 3 hours here. Another visit like this will happen after 2 weeks. We embark on our return journey. Again, adventurers. Jacob Lam is one of the boat drivers on the MSF outreach missions.
We have challenges on the river. It's not a crocodile alone. It's not the hippo. Hippo are very big, but they are very far. We cannot meet with them. We have some little big problem. We have a canoe. We have some local people are moving inside the river with their boat or whatever they make that they can cross with it. Yeah, that is a big challenge. Like you came, you didn't see, or even like if you see and you fast, you didn't stop the engine, so you will end up capsizing the boat that is using, or the local canoe that is using.
When Lam is not on the boat, he would be in the field playing soccer, one of the main pastime activities in Old Fangak town. Community drama is also important here, and this is one of the important methods MSF uses to educate the community on primary health care. My stay in Old Fangak would be incomplete without attending some of the sessions. Indeed, service to humanity is service to God. That was my experience in Old Fangak in the north of South Sudan as I came face to face with what humanitarian workers go through. Special thanks to Médecins Sans Frontières, or Doctors Without Borders. And to our viewers, many thanks for watching.